My name is Elizabeth Wickham.
I'm Dee Dee Cotton.
We are second-year DPT students at Campbell University. Today we are demonstrating central and unilateral anterior glides with physiologic motion. Unilateral anterior glides with physiologic motion can be used as an intervention for nonspecific low back pain with mobility deficits by enhancing motor function through the facilitation of neurophysiological effects. Multiple research studies have demonstrated that the application of PA mobs to the symptomatic spinal level for 3 one-minute intervals significantly reduces patient pain and spinal stiffness, as well as improves lumbar extension through decreased muscle guarding for improved motion. Adding physiological motion enhances the distribution of synovial fluid over the articular cartilage and disc, resulting in less resistance to motion. Multiple treatment sessions has a greater impact on patient pain and mobility than a single treatment.
According to Wise, when we look at the skeleton, we can see that as backward bending is facilitated, the spine extends, which allows for the closing of the spinous processes. Looking at the spine, you can see that the inferior facet of the superior vertebra glides down and backward onto the superior facet of the inferior vertebra. The nucleus pulposus migrates anteriorly as the annulus fibrosus bulges posteriorly. This allows the spinal canal and the intervertebral foramen to close. For the prone backward bending technique, have the patient lying prone on the mat. The therapist is in a straddle stance position at the side of the patient. For a central anterior glide, the region distal of the pisiform of your mobilization hand is in contact with the transverse process or the spinous process of the segment to be mobilized. The therapist's forearm is in line with the direction in which the force is applied. For the unilateral glide, the therapist uses thumb-over-thumb contact or the hypothenar eminence contact at the transverse process of the segment to be mobilized. The forearm is in line with the direction in which the force is applied. To advance this technique, in the prone position, the patient pushes up from the table while the therapist applies the mobilization force. If I was going to explain this technique to a patient, I would say, use both hands to slowly push up like you're going to do a push-up. Now hold that position. I'm going to use my hand to push down into your back where it hurts. I'm going to do this for 1 minute while you hold that position. While doing the backward bending, I'm going to close this segment of the spine and help achieve more movement in your back. This technique can be performed in the seated position. The mobilization belt should be secured at the anterior aspect of the patient's pelvis. The patient will sit with arms across their chest, then actively extend their spine. The therapist stands behind the patient with the mobilization belt secured at their gluteal folds. The therapist places thumb over thumb on the spinous process while applying weight through the gait belt to exert a mobilization force through the glide.
The goal of central or unilateral anterior glides with physiologic motion is to reduce pain and increase spinal motion. To assess the effectiveness of the technique, the therapist should compare pre- and post-treatment measures of patient pain and spinal movement. To assess patient pain, the patient should report using the VAS pain scale. To assess spinal motion, the modified Schrober method can be used. An inclinometer can also be used to measure flexion and extension range with an added patient report of the severity of pain experienced when these movements were recorded.